In this procedure, you will learn how to collect a venous blood specimen using the vacuum tube technique. Read the provider's order and clarify any questions with the provider. Gather the appropriate tubes as specified on the requisition form and all other required supplies. Put on a fluid impermeable lab coat. Verify the patient's identity using 3 identifiers, such as her full name, date of birth, and the spelling of her last name, or showing a photo ID.
Hello, Tina. How are you?
Good. How are you?
I'm good. My name is Tori. I am Dr. Anderson's medical assistant. If I could get your first and last name, please.
It's Tina Lakin.
Okay. And if you can please spell your last name for me.
Lakin.
Your date of birth, please.
4/21.
Explain the procedure and obtain permission for the venipuncture.
Tina, it looks like Dr. Anderson has ordered some blood work for you to have done today. Do you have a problem with getting your blood drawn or had any issues?
No.
Okay.
Put on protective eyewear. Wash or sanitize your hands again.
All right, Tina, let's look and see which arm is the best. Does it matter which arm I use?
It doesn't matter to me.
Okay, let's take a look.
Ask the patient if she has a preference which arm is used for the venipuncture. You should look at both arms to find the vein that will give you the greatest chance of success. Have the patient sit with her arm well supported in a slightly downward position. Apply the tourniquet around the patient's arm 3 to 4 inches above the elbow. The tourniquet should never be tied so tightly that it restricts blood flow in the artery. Tourniquet should remain in place no longer than 60 seconds. Select the venipuncture site by palpating the antecubital space. Use a finger to trace the path of the vein and to judge its depth. The veins most often used are the medial or cephalic veins, which lie in the middle of the elbow. Remove the tourniquet and cleanse the site, starting in the center of the area and working outward in a circular pattern with the alcohol pad. Assemble your equipment and supplies on the non-dominant side of the patient's arm. The choice of needle size depends on your inspection of the patient's veins. Attach the needle firmly to the vacuum tube holder. Keep the cover on the needle. Then, put on a pair of gloves. Reapply the tourniquet when the alcohol is dry. Hold the vacuum tube assembly in your dominant hand. Remove the needle cover. Your thumb should be on top and your fingers underneath. Grasp the patient's arm with your non-dominant hand and anchor the vein by gently stretching the skin downward below the collection site with the thumb of your non-dominant hand. With the bevel up and the needle aligned parallel to the vein, insert the needle at a 15 to 20 degree angle through the skin and into the vein with a quick but smooth motion. Your dominant hand should never let go of the needle assembly once it is in the vein. Hold the assembly in place and steady through the venipuncture. Place 2 fingers of the non-dominant hand on the flanges of the needle holder and use your thumb to push the tube onto the double-pointed needle. Make sure you do not change the needle's position in the vein. Allow the tube to fill to its maximum capacity. Remove the tube by curling the fingers of your non-dominant hand underneath and pushing on the needle holder with your thumb. Take care not to move the needle when removing the tube. Immediately after removing the tube from the needle holder, gently invert the tube to mix the additives and the blood. Insert the second tube into the needle holder, following the instructions in the previous steps. Continue filling tubes until the order on the requisition has been filled. Gently invert each tube after removing it from the needle holder. As the last tube begins filling, release the tourniquet. The tourniquet must be released before the needle is removed from the arm. Remove the last tube from the holder. Place gauze or a cotton ball over the puncture site and quickly remove the needle, engaging the safety device. Dispose of the entire needle and holder assembly in the sharps container. Apply pressure to the gauze or instruct the patient to do so. The patient may elevate the arm, but should not bend the elbow.
You can elevate your arm if you like, just do not bend it, okay?
Okay.
While the patient is applying pressure to the site, label the tubes with the patient's name, date and time, and your initials, or affix the pre-printed tube labels and print your initials on the label. Check the venipuncture site to make sure bleeding has stopped. Apply a hypoallergenic self-stick wrap, gauze, and tape, or bandage. Dispose of blood-contaminated materials in the biohazard waste container. Disinfect the work area. Remove and dispose of your gloves. Then, remove your protective eyewear. Wash or sanitize your hands. Complete the laboratory requisition form and route the specimen to the proper place. Document the procedure in the patient's record.